Okay. Hi, good afternoon. I am Rachel DePaul, and I have the privilege of being the Vice President of Programs at the National Kidney Foundation of Illinois. And I'm so excited that you all are here to join us today for this really impactful Kidney Connections, where we're really going to focus on lupus. The mission of the National Kidney Foundation of Illinois is to improve the health and well-being for people at risk for or affected by kidney disease through prevention, education, and empowerment. I'd also like to take a quick moment to just thank our sponsors for today, Fresenius Kidney Care, UI Health, and Northwestern Medicine. I'll also remind you, if you can, to please make sure to stay connected with NKFI through our social media channels, and also check out our podcast, The Journey Continues. So as we get into today's discussion, I'd like to introduce our moderator, Kimberly. She is a 4-time kidney transplant recipient and brain cancer survivor who passionately advocates for patients. Kimberly underwent both in-center and home hemodialysis for 6 years, and she uses her voice and experiences as a patient to support others who are beginning their journeys with kidney disease, with kidney dialysis, transplantation, or kidney disease. Kimberly is a motivational speaker and tireless advocate for kidney disease awareness. And then I'd also like to introduce you to our 2 panelists. So we have Dr. Cunningham, who is an associate professor of medicine at the University of Chicago. He is a nephrologist who specializes in the treatment of glomerular nephritis and nephrotic syndrome. His other clinical activities include caring for patients with kidney transplants and using bedside renal ultrasound to aid in the diagnosis of kidney disease. And he's also the vice chair of our NKFI research committee, so I had to add that into his bio. And then we also have Dalila, and she is a Chicago native, a dedicated mother, and an elementary school teacher. She was diagnosed with systematic lupus erythematosus in 2006 and received her first kidney transplant from her mother, followed by a second from her cousin after years of dialysis. Her journey with lupus has taught her resilience and the value of family support. Now, Dee advocates for invisible illness awareness and shares her story to inspire and empower others. And before I turn it over to Dr. Cunningham for the first part of today's presentation, I'm just going to do a shameless plug to remind you to register to join us in person for our next Kidney Connections session on September 13th. And then also a reminder to register for our virtual session, our next Lunch and Learn on Thursday, November 13th. So that being said, I'm going to turn it over to Dr. Cunningham.
Thank you very much. And I just want to double check you can see my slides correctly, correct?
Yes. We can, but we're seeing the notes field too. So we're seeing kind of the presenter view right now.
All right, I'll try plan B here. One second. Does this look right?
That does. You got it. Thank you.
Okay. All right. Well, thank you very much. I'm going to talk today about lupus in your kidneys. Lupus is a common cause of kidney failure, kidney disease. It's a very unusual disease, but we have effective treatments for it. So I'm going to give you an overview of what you should know. So what is lupus? So the official name of the disease is systemic lupus erythematosus, or SLE. And it's an autoimmune condition where your immune system can attack many different organs in your body. It often involves your skin causing a rash, joints causing arthritis, and less often can affect your lungs, your heart, can cause blood clots, it can even affect your brain. And it often involves your kidneys. And I have numerous patients with lupus kidney disease, and it doesn't have to involve your kidneys. But about 200,000 Americans have lupus, so it's not that rare. I want to stress it can behave very differently in different people. One person's lupus is very different from another person's lupus. Some people have a milder case, some people have a more severe case. And it can tend to flare up unpredictably, and then it can tend to quiet down unpredictably. So it's a very unpredictable type of condition. So who can get lupus? Anyone could get lupus, but it's definitely more common in females with a 9-to-1 ratio of women to men. Now, the men who get it often have a very severe case of it. It can also occur at any age, including the elderly, but it most commonly starts in young people, even in teenagers. It's more common in people of African, Hispanic, or Asian ancestry, but it can again occur in anyone. It occasionally runs in families, but it's not so common to see it where multiple generations have lupus. But I'll talk a little bit later briefly about how there is maybe a genetic reason why some people are more likely to get it. So what does lupus do to the kidneys? Well, your kidneys are filters. Blood goes through their kidneys, and that's where urine is made to clean the blood. And each kidney has about 1 million little filter units, and they're called glomeruli, which I know is a mouthful, but you see in the picture here, the blood goes in to the glomerulus, and then it leaves, and across little tiny holes, water and waste products are squeezed, and that's where the urine comes from. And when the glomeruli are damaged by lupus, we call it lupus glomerulonephritis. Neph means kidney, and itis means inflammation. And it can take many forms, and we have kind of a complicated classification system. I'm not going to go into that, but it can be milder, it can be more severe. And what essentially happens is when your immune system is attacking your body, various parts of your immune system, like antibodies or white blood cells, can get into these little filter units and plug things up and cause damage and cause irritation. And if this is picked up early, our medications can heal the inflammation. But if it goes on for a long time, we unfortunately can see scarring, which can be irreversible. I kind of sometimes tell people it's like a scar in your skin. If you get injured when you're young, even many, many years later, you can still point to that scar. And I wish we had a medicine that could dissolve scars, but we don't have anything like that. So, when these filter units are damaged, you can see a leakage of protein into the urine, which is not normally supposed to be there. You can see red blood cells in the urine. Sometimes patients can actually see blood in their urine. That's a little unusual, but can happen. Over time, especially if there's more scarring, the kidneys can lose their ability to do their most important job, which is cleaning your blood. And the waste products, which a healthy kidney would get rid of, can build up and to high levels and make people sick. So this is lupus glomerulonephritis. So what symptoms can point to lupus? Well, there are actually many different symptoms. And again, one patient with lupus is very different from another patient with lupus. So it varies a lot. But some classic things you might see is there can be a classic facial rash, which I show in the picture here. It's called a malar rash, which is across your cheeks and the bridge of your nose. But you can have rashes on other parts of your body. You can sometimes have mouth sores, hair loss. You can have arthritis causing hand or foot pain. Sometimes it causes a fever, which, patients have fevers and we can't figure out why they're having them, and it doesn't seem to be an infection, and it turns out to be lupus. It can cause swelling. If the kidneys aren't working, fluid can build up, and the swelling, because of gravity, often goes to your feet and legs. It can cause a lot of swelling. You can get swollen glands as well. Now, if the lupus is only involving the kidneys, and we definitely see people like this, sometimes patients may not have any symptoms, and it may just show up on routine blood and urine tests that you have protein in blood and urine. So again, it's very variable. And we live in a day and age where you can Google various symptoms, and lupus does tend to mimic all kinds of other diseases. So if you enter your symptoms into a search engine, it might suggest you have lupus. I do want to point out there's many, many other things that are not lupus that can cause a rash or cause fever. So we can't base the diagnosis just on the symptoms alone. We have to do further testing. So what causes lupus? This is a very difficult question to answer, or this is a very difficult question for me to answer when patients ask me about it. We don't totally understand lupus. We do understand a lot of it, though. But this is my best attempt at an answer, which is we all have this very powerful immune system inside us, and we don't really appreciate how hard it's working at all times to fight off infections. That's its job. But sometimes it gets confused and it attacks your own body. And once it goes down this path, it's hard to turn it around. So it is because of your immune system attacking your own body. And there's pretty good evidence that this is partly due to your genetic background. Like I said, it doesn't usually happen where my grandfather had it, my mother had it, and now I have it. But we each get a complicated, large number of genes from your mother and your father, and they combine in complicated ways and make some people more likely to have it. And what we think happens is in some people who have this likelihood, there is some kind of infection or something in the environment that touches it off. So to be clear, lupus itself is not an infection. People don't pick it up from someone. They're not going to spread it to anyone, but it's probably a combination of your genetic tendency and something in your environment that triggers it. And that's my best attempt at an explanation, but we don't totally understand. So how can you get evaluated for lupus if you think you might have it or a loved one has it? And if it's involving your kidneys, we can detect kidney problems with fairly routine blood and urine tests. Now, of course, this, all this tells you is you have some kind of kidney abnormality, but this could be from many other things. For instance, diabetes is the most common thing in the United States that causes kidney disease. So to see if it's from lupus, we need more specialized, more unusual blood tests. And these can be tricky to interpret it. And some primary care doctors do a very good job of this, but some of them, it's beyond their expertise. And so it's very important to get specialists to help you interpret these tests, such as a nephrologist or especially a rheumatologist. Everyone with lupus will need to work with a rheumatologist. That's the specialty that specializes in autoimmune conditions and helps guide their treatment. So based on symptoms and blood tests, it can help point us towards lupus. Now, if the lupus is involving your kidney, we typically have to do a kidney biopsy to find out the amount of damage and the form of damage and how severe it is. This is just a picture of a kidney biopsy that we occasionally have to do in lupus patients. And it's not a surgery, it's an outpatient procedure, but we use a special needle under ultrasound guidance after we give some local anesthesia, and we go into the kidney with this special needle and we get 2 or 3 little tiny pieces of kidney, and that way we can look at it under a microscope and do certain tests on it and see the extent of the damage. And it's really helpful to kind of help us decide on what therapy to recommend. So we don't like to do these biopsies too often, but it's typically necessary at the beginning after we figure out that someone has lupus. So how do we treat lupus? I want to stress that the treatments we give usually work, and if they can't put lupus into total remission, it can at least slow things down and get things to settle down. But the typical treatment are certain pills like mycophenolate and hydroxychloroquine that in many studies have been shown to help patients. We often use steroids like prednisone in the short term, especially if there's a lot of inflammation, and the prednisone can be really helpful at the beginning. Over the long term, it has a lot of side effects, so we don't want people on this long term, and so we're trying more and more to get people off of prednisone long term, but in the short term, it's a very effective medicine as well. Also, if your kidneys are involved, it is very helpful to kind of help protect kidney function, to control the blood pressure as perfectly as possible. And there are certain blood pressure medicines like ACE inhibitors or angiotensin receptor blockers that have special kidney protective effects. So I really work closely with my patients to try to maximize this aspect of treatment. But the mycophenolate, hydroxychloroquine, these are medicines that deliberately reduce the activity of your immune system to kind of reduce the inflammation in your body. Now, I do, of course, want to say if you're on all these pills, the medicines only work if you take them. And this is a struggle, especially in some of our younger patients who I know from experience, sometimes teenagers don't like to take necessary medicines. But medicines are metabolized to your body within hours. So within 12 hours, they start to leave your body, and then your immune system can wake up and start to attack things again. So you really want to be good about taking your medicines and kind of keep things under control 24 hours a day. Now is a good time also because we're developing newer medicines that might be better, that might help people who aren't controlled on the standard therapy. So these are, we call them biologics, because they're more specific to certain parts of your immune system that are causing the problem. And so there's a medicine, belimumab, which we are adding on to people who can't get things under control with the standard therapies. There's another medicine we use fairly often, rituximab. These medicines are fairly well tolerated without too many side effects, and they can help more and more patients. So, and there's newer medicines coming out over time. So it's satisfying to see us have more options to treat every patient. So if you have lupus and you're on these medicines, not every patient, but I see many, many patients who can live normal, active lives, who can exercise, who can work. It is a burden to be on these medicines, and it is a burden that you need to get frequent blood tests and frequent clinic visits, because you can't always feel it if the disease is progressing, but many people can have very active lives. And along these lines, one question that often comes up in young women who have lupus is, can I have a baby? And it's not easy, but the answer is yes. Most women with lupus are able to have a successful pregnancy. You have to plan ahead. Some of the medicines, like the mycophenolate or like some of the blood pressure medicines, can definitely cause birth defects. So it's very important to plan pregnancy ahead of time and switch off of these medicines first. And there are some safer alternatives, some much safer alternatives you can switch to. And if you become pregnant then, that eliminates the chance of birth defects. There are still some complications like preeclampsia that are more common. But if you work with a team of specialists, like a high-risk OB doctor and rheumatologists and nephrologists, many women with lupus can have a successful pregnancy. So that's obviously an important part of being a young person to many people. So what if treatment fails? Unfortunately, there are some people who, especially if we catch things late or start treatment late, there can be a lot of scarring in the kidney. Now, we're all born with way more kidney function than we need to get by in life, but once your kidney function drops to under 10 to 20% of normal, you can get symptoms of kidney failure like fluid buildup, electrolyte abnormalities. The toxins can cause loss of appetite, nausea. It can just make people feel awful. At this point, we do often have to start dialysis, which is a machine that cleans your blood. And dialysis saves lives for sure, but over the long run, it's a hard lifestyle. It has a lot of side effects. So hopefully in patients, dialysis might be necessary for a period of time, but ultimately, if the lupus has damaged your kidneys enough, people may need to get a kidney transplant. And there are many people with lupus who have a successful kidney transplant, and that gives you the longest lifespan. It gives you the best quality of life. You do have to take a lot of medicines to kind of suppress your immune system and keep the kidney, help your immune system tolerate the kidney transplant. But this is definitely what your target should be if, unfortunately, you've had kidney failure from lupus. And you might wonder, might the lupus come back and affect the new kidney? This doesn't happen very often, thank goodness. The medicines you're on usually keep this from happening. So we don't see this very often, fortunately. So just to sum up, lupus is a common cause of kidney disease, especially in young people. It is a tricky diagnosis to make, and there's a lot of questions that come up when we're trying to figure this out. But if we get the right diagnosis, there are effective treatments available. There are newer, probably better treatments coming out over time. And so we should have a hopeful attitude about this. And so that's what I had to share. I hope you found that useful. Thank you very much.
Thank you so much, Dr. Cunningham. That was very insightful. My goodness, there's a lot going on in there. So
Yeah.
we're going to have a very good hour together. So next, before we get started, I'd like to address and introduce Dalila Chavers. And she speaks to one of the points in your presentation about giving childbirth while having lupus, because Dalila was blessed enough to be one of those that after
Yes.
she was diagnosed with lupus, that she was able to give birth. So Dalila, tell us your story.
Yes. Thank you, Kim. Hi, everyone. My name is Dalila Chavers. I will start from the beginning. I won't be too long because sometimes I can chat a little too much. All right. So it was the year of 2006. I was going back to NIU in August, Northern Illinois University. Um, and I woke up that morning with almost all the lupus symptoms that Dr. Cunningham just mentioned. I had the butterfly rash on my nose and my cheeks. I had a fever of 103 degrees. I'm sorry, excuse me. I also had swollen joints, pain, severe fatigue, and very much a lot of throwing up and things like that. So my mom rushed me to Trinity Hospital. I was there for about 3 weeks. The doctor could not figure out what was going on with me, what was wrong. So they had to transfer me to UIC. I was there for about 2 days, and that's when they told me that I was diagnosed with lupus, SLE lupus. After that, they started giving me mycophenolate, prednisone, and different other types of medications. I was in the hospital for about 3 weeks. After that, I was released. I started to live a normal life again, started to get my life back, started to get more energy back and things like that. But I was still having a lot of complications with my body. On and off, my immune system was getting lower and lower. So I was continuously going to the doctor with fevers. The rash wouldn't go away. My feet were enormous, very swollen. So they did a lot of more testing. And that took about 2 years to figure out what was really going on. So in 2009, found out that both of my kidneys had failed um, due to me having lupus. So my lupus attacked both of my kidneys. And with my good support system, I had so many family and friends line up for me to get tested. But my lovely mother, Dawn, she instantly said, I'm giving my baby a kidney. So 2009, October 2009 to be exact, I had my first kidney transplant. Um, totally different lifestyle after that. I was able to go back to work. No more swelling, no more fevers and things like that. But a year after that, my creatinine number was not stable. So I was going in and out the hospital as well because my lupus kept attacking my immune system. So I was also having like a lot of symptoms from me not taking care of my health as well. I wasn't eating correctly. I wasn't used to taking a lot of medications. As Dr. Cunningham stated earlier, if you don't take your medications while having a transplant and having lupus, your body will attack your immune system. So that what was going on with me. I personally didn't take it serious in the beginning. So I had my mother's kidney for about 8 years and it failed. That's when I fell into a deep depression because I found out that I had to do dialysis. At first, my mother was the one to, say, I'll give you the kidney. And I had a lot of people lined up for me. But the second time around, no one. And I didn't get upset, but I kind of was because it was like, it was a big life lesson for me. So before I did dialysis, I did peritoneal dialysis, and that is when machines are set up at your house for you to do the treatment at home. So I was set up, and I have to say this first: the area where your dialysis machine is set up at home has to be super clean. So I had did it in my bedroom for 8 hours a day at night while I was asleep, but for some reason I kept getting infections at home. So then I had to transfer over to the dialysis in the center. So I had to do hemodialysis then. So I was on dialysis from 2016 to 2018. Um, about a year before I would say around like 2017, I was having problems urinating. I could not use the bathroom at all because the dialysis, it wasn't dialysis that did it, but my kidneys wasn't really functioning as well. So one day I was trying to do a blog. I was trying to create a blog to raise awareness about kidney health. And one of my cousins, who I wasn't that close with back then, who I'm close with now, seeing one of my videos on Snapchat. I went from 145 pounds to 98 pounds. So I dropped a lot of weight. So once he seen my video, he was very concerned about what was going on with me. And I told him, I'm on hemodialysis and I need another kidney transplant. He didn't even know that I had the first kidney transplant. So he instantly said, "Oh, I'll get tested for you." To make a long story short, I'm trying to think, that was October of 2018. So he went through the whole process with not stopping the blood work, everything. And Kimberly here was his nurse at the time, I believe. And she was just talking to him and motivating him. And she was just there with us the whole way, the whole way. And then January 2019, I got my second kidney transplant. So the second kidney transplant, I completely changed my diet, never missed a dose of my medication. I've been praying more, eating right, exercising, controlling my mental health, because that's very important too as well. Because a lot of things trigger my lupus, like stress would trigger my lupus big time. Stress and bad eating habits triggers my lupus. And the symptoms that I would have with those is severe fatigue, and then I would have loss of appetite and severe joint pain as well. So from my first kidney transplant in 2009, I have learned a lot since then to take care of my health a little bit better, to make sure that this kidney will last longer than the first one. They say, I did a little research of how long does your kidney last. It can last over 20 years from my research that I've done. So hopefully mine will last past that. So after 2019, when I received my kidney transplant, I went back to school. I received my master's degree in business administration. I've worked a full-time job. And then a year before 2021, I was on a medication called mycophenolate. My doctor took me off of that. Now, my pregnancy was not planned, but I ended up finding out that I was pregnant in 2022 with my daughter, Camila. So the medicine mycophenolate would prevent me from having kids. But since I was off the medication for a whole year, I was able to reproduce. Now, this is very surprising. During my pregnancy, I was on prednisone, a high blood pressure medication called Labelo, and Invarsis, which is for my kidney transplant. My whole pregnancy, the whole 9 months, was perfect. I had no symptoms. My lupus did not flare up at all. I did lose a lot of weight because I didn't have an appetite. That was the only thing. I was high risk as well, though, because I have high blood pressure, of course, kidney disease and lupus. But I have to have a planned C-section, so I had to deliver her at 38 weeks. Towards my delivery, I developed preeclampsia because my blood pressure elevated very high. So they had to do an emergency C-section. And about a week after my birth, my lupus flared up very bad to the point where I couldn't walk. I couldn't take care of myself. I needed help, like doing a lot of things for myself. So they increased my dose of prednisone, and then they also gave me a lot of fluids in the hospital as well. So that took about a month for me to get back to myself after I had my daughter. But now, like, it's been almost 7 years. I've not been in the hospital at all. And before that, I used to live in the hospital. Now it's been almost 7 years. I have not been admitted. I go to my regular doctor's appointments 3 months after year, every 3 months after year, so 3 times after year to get blood work and urine testing to make sure everything is good, and everything has been perfect. So that's my story, and I'm glad that you guys invited me to help me tell my story so I can help as well bring awareness to whoever is losing hope, who need help, who's feeling down, who's feeling hopeful, and things like that. If you take care of your health and listen to your doctor, take your medications, and just follow through with your doctor's appointments and don't miss any doses like I did, you will be okay. You will be okay. So that's my story.
Thank you so much for sharing that, Dalila. You are such an
You're
inspiration.
welcome.
Girl,
Thank
every time
you.
you tell your story, I get a little weepy because I just remember sitting in the lobby that day when your cousin was trying to fill out his FMLA forms. So it just seems like it was just yesterday. And just yesterday when we were celebrating your kidneyversary, eating tiramisu
Yes.
for the first time. So that is amazing. And so little Camilla is how old now?
She's 2.
2.
Yep. Is a yep.
Yeah. So I had similar issues with my pregnancy, actually, but with my first pregnancy. So my story is I developed lupus after my daughter was born. So I'll ask Dr. Cunningham to speak to this. That is that pregnancy, if your lupus hasn't presented itself, that I've heard that lupus, the stress of pregnancy, could trigger it if it's dormant in your system. And for me, I believe that was the case because I started developing symptoms of lupus after my daughter was born in 2000. And I was nursing and I was having really severe joint pains, having a hard time walking. And the doctors, kind of kept dismissing it as that I was calcium deficient because I was nursing. And so I think lupus is one of those things that it's hard to diagnose. Doctors, like you had mentioned in your presentation, that PCP providers aren't well versed in it enough sometimes, and they kind of dismiss it or overlook it. So we finally were able to get to a rheumatologist where I was treated, and I was doing Cytoxan, actually. And I would go into the hospital, receive the Cytoxan, come home, and then get up and go to work in the morning. Well, clearly most mornings did not work well because Cytoxan is a very toxic drug, or at least for my body it was. It's almost I'm not sure if it's a form of chemo, Dr. Cunningham?
It is, yeah.
Yeah. So I would get that at night and then come home and go to work. So that was my routine of how they were initially treating my lupus. But with my first pregnancy, if you get to the right team, they will do all of the preventative medicine. So I was giving myself injections to prevent blood clots and a few other things. So you can have a healthy pregnancy, yes, with some preventative measures. Sadly, with my second pregnancy, we did not do the preventative things. And I think that made the difference. So doctor, what you had mentioned that some of the meds, particularly prednisone and some of the perhaps mycophenolate, have long-term effects. What would those be?
Well, the prednisone and those type of medicines are not so good for your bones. There's all kinds of things. It can tend to cause diabetes, at least temporary diabetes. It has actually so many side effects. It can affect people's sleep. It can make people gain weight. It can make infections more likely. So you might say, why would we ever give this medicine? It works quite well in the short term, especially when people have a lot of inflammation. But there's been more appreciation. We don't want people on that forever. So some of these newer drugs can maybe help people get off of it. And then the mycophenolate is the other drug that we use in most people. Most people tolerate that pretty well. Sometimes it causes some diarrhea in people, usually not. All these medicines, we're kind of weakening the immune system on purpose to help the lupus, and it does make infections slightly more common. So we do kind of have to, sometimes treat infections in patients or have that on our mind. So to catch it if they, if they get, a cold, it might take them a long time to get over it. It might be more likely to turn into pneumonia, things like that.
Yeah, I always tell people when because our immune systems are weakened, we are a lot more cautious. We carry around the hand sanitizers. We're washing our hands. A lot of people don't hug as a result of it. I always tell people when they're around me and they're ill, they just get a cold. I get hospital footies. So it's definitely one of those things that it can be complicated if we catch something as simple as a cold. Yes. So May just happens to be lupus awareness as well as mental health awareness month. So mental health, Dalila, you had mentioned was one of those things. So how do you deal with those mental health issues that lupus that brings?
So at first I was not dealing with it very well. Like I said earlier, I was diagnosed at 19. So once I found out that I couldn't hang out with my friends and go out and party and things like that, I was abusing myself by going out partying, drinking, destroying my kidney without even knowing it, because I'm thinking, oh, I received a transplant, so I'll be okay. But I was still feeling sick. I wasn't feeling myself still, so I was missing my normal life. So that's how I dealt with it at first, but which I'm not telling no one to go that way. Now, what I do is I meditate a lot. I meditate, I pray a lot. I write everything down, everything, whatever I'm feeling. I have a little journal. I'll talk to my mother and my sisters. I also was thinking about going to therapy as well, to help with my mental illness. I take walks outside, but the number one thing is literally seeing my daughter. Just when I come in the house, she runs to me, and it helps me because I'm fighting for her. I have to live for her now. It's not just me no more. So with me having my daughter, she has been the biggest, try not to cry, motivation and blessing in my life, because she pushes me to control my mental health. So writing everything down, as I said, and talking about it to somebody. I don't hold anything in at all, because I used to do that and it balls up inside and then it comes out the wrong way. So I talk about it now. So it helps for me.
Do you find it helpful to have a person, like another person who's living with a chronic illness?
Yes.
Is that important to you? Or does that make a difference in how you communicate or express your feelings?
Yes, because I feel like I'm not alone. I feel like I was alone for a long time. And then when I hear other people's stories whose journey was worse than mine, I was like, oh, and then we could communicate better because they understand. A lot of people who, if I'm just don't feel like going out, oh, you're lazy, you don't want, no, I'm tired, but they don't understand that because they don't have lupus and they wasn't dealing with it. So when I talk to other people who is going through what I'm going through, it makes it a lot easier. And one of my friends she just received her kidney transplant last week, who was going through, she just got diagnosed with lupus 3 years ago. So I visited her in the hospital and I just had this conversation about that with her. So it helped her mental health with me talking to her about it, because she knew that I had lupus as well, going through a kidney transplant. So it's really important to talk to somebody. But for me, it is better talking to someone who who understands, who's been through exactly what you went through. So, yep.
Dr. Cunningham, you had mentioned that part of the medical team for someone who has lupus is a rheumatologist. Is there a set team, like as we were talking about, mental health, depression is a big piece of having lupus. Is that part of the care team, or is that something that somebody would have to advocate for to have?
I think it's really important. I'm not sure if it's necessarily part of the team at the beginning, but I think it's important that all the doctors have awareness that people, if they can help their mental health, and they can help, take care of themselves the best. And so we have a pretty low threshold to kind of give people resources for someone to talk to if they have mental health problems. I think that's really important.
Yeah. You had mentioned that you didn't feel or think that lupus was kind of passed along. We have someone that was asking, first of all, I'll ask, there's a question in the chat that says, Dr. Cunningham, is there a way to know if lupus is dormant in your system pre-pregnancy?
Yeah, so with blood tests, we can get a sense of if it's relatively quiet, and maybe if it's not quiet, if it seems like the blood tests are pointing to it to be very aggressive, maybe that is not the best time to get pregnant. Those blood tests are not perfect though. Sometimes, it's having a baby is kind of a life, important life milestone. So, we don't want to just put too much stress on just what tests show. But we usually have a sense if people are taking their medications, the medications are working. We usually have a sense of now is your an opportunity to go ahead with pregnancy.
So you had mentioned that you didn't think that it was hereditary, perhaps, or maybe not, or it might be in certain cases. I can tell you that for me, I remember being a young child, and we went to a funeral of a cousin 3 times removed that I did never met. And it was one of those things that was not really discussed again amongst the younger kids. So I never really fully understood or knew why she passed. My mother had lupus. So I grew up in the household with a mother who had lupus, that SLE that turned into lupus nephritis. So my uncle donated his kidney to her. I remember when I was in 8th grade, my grandfather came to pick me up and we went to the hospital. So I kind of knew that it was a family trait back there, but I never, like Dalila said, when you're young, you feel you're invincible. You don't think that you can get it. You're not sure. So I just kept living. But with the first pregnancy, as I mentioned, we were more precautious. With the second one, I kind of was in, okay, we made it through one child. Of course, I'll make it through the next. So now that I have a daughter, and that you had mentioned that it's predominant in African-American females, Native American as well, and I think Hispanic, yes. So I began having her tested regularly, and now that she's old enough and can do her own testing. So what I asked you probably 3 questions in there about the hereditary, and then what specific testing can and should people be asking for from their primary care providers to check their lupus levels if they think that there's a history?
Yeah, so no, it's interesting that your mother had it. I didn't want to overstate it. I would say most people with lupus, I ask them, does anybody in your family have it? And usually the answer is no. But there are certainly exceptions, and if they talk about wider relatives, it's not uncommon to have some other relative who had it. So I meant it's not usually something where my grandmother had it, my mother had it, now I have it. Like some other genetic diseases that are really strongly inherited. It's not like that, but there is definitely some role that heredity plays, because there's 20,000 genes and we get one copy of each from your mother, one copy from your father. They combine in complicated ways, so there probably is, in a more indirect way, some kind of genetic explanation. But so your question is a really good question. So you're worried, could your daughter have this?
Yes.
And that is a question that's honestly beyond my pay grade. That's where I think a rheumatologist would be helpful. The most common test to look for lupus is something called the ANA, the anti-nuclear antibody. Now the problem with that test is if it's strongly positive, that kind of is a good sign there could be some kind of autoimmune disease. And it doesn't necessarily mean it's lupus. And on the other hand, it's really common to have a weakly positive, a false positive test. It's more common in women, have just a borderline test that might mean nothing. It might not mean you have lupus. So you can ask your primary care doctor about it, but honestly, if you really want to know your risks, it might be better to kind of consider going to a rheumatology doctor. And there's some other tests they check, like called complement levels, and there's a test called RNP Smith that is more specific to lupus. But that's a tricky question. Even if you have the positive test, if you have no symptoms, if you have no kidney problems, does that even really mean you have lupus, or does it just mean that you're at risk for it? So I'm sorry, I don't have a great answer for that question, but
it's okay. That was helpful.
But a rheumatology doctor would be helpful there.
Hey, Kim, I'm sorry, I have a question. How old is your daughter?
She'll be 25 in December.
Oh, okay. So what would be, I don't know if you can answer this, Dr. Cunningham, what would be a good age to get her tested? It doesn't have to be like teenage, early adult, like 15, or like what's the earliest can you get your child tested for that?
I mean, you can get the blood test at any point, but it's hard to say when just because it's negative when they're young doesn't rule it out. They could get it. Things change, your body changes, your immune system changes. So you might have, normal testing when you're 15, and you might get it when you're older, or you might not. So it's hard to say. And what always worries me honestly about testing is it causes a lot of anxiety in people. And if there's nothing to do about a problem, do you really want to have these kind of borderline tests that are weighing you down in your mind? I sometimes worry that if we do too much testing, it causes unnecessary anxiety. So you don't want to overdo it.
Yeah, that's definitely a thing that I'm seeing with my daughter. It's definitely, though, something that we talk about as far as her future for family planning and things to be conscious of or aware of, So what support? We had a question. Should we ask to be tested for lupus if we don't have symptoms? Is there something to look for? And I can feel like I think go ahead, but we talked about like the joint pain, go ahead.
Yeah, so rash, joint pains, those are some common symptoms, but many people don't have those things. So I personally, if you don't have any of those symptoms and you don't have any kidney problems, I wouldn't just ask to have things checked. That goes along with what I was saying a minute ago about we don't want unnecessary anxiety. I don't want to make it sound like lupus is that common, but everybody's situation is a little different. So you can talk to your doctor and get their opinion about your specific situation. But I don't think people should just be tested just because. No.
Yeah, I think it's important to note too that you should know your triggers if you have lupus, because everybody has different triggers. Dalila, you mentioned yours is stress, mine as well as stress, lack of sleep,
yes,
is one. Overstimulation. Sometimes I just need to be away from people.
Yes.
I don't know that that's lupus specific per se, but and definitely, so knowing your triggers. I know I'm going to pivot a little bit here, that I've heard it said, and we know that lupus also causes sun sensitivity, and people with lupus should avoid sun. Can you address that, Dr. Cunningham?
Yeah, I almost put that in the presentation, but yes, too much sunlight can sometimes, especially, trigger the skin condition to flare, and it might sometimes trigger the lupus overall to flare inside your body. So, so the dermatologist that might see patients and the rheumatologist have pretty good advice to patients about this. Maybe I should talk to patients about this more. I actually don't. But yeah, avoid too much sun, long sleeves, sunscreen is probably helpful.
I know that that's common also because of with transplant patients, because one of the things that when you get a transplant is that you are more susceptible to skin cancer.
Oh, for sure, yeah.
So if you have lupus and have had a transplant, Ms. Dalila, even though we're melanated, we need to make sure that we are putting on sunscreen. So can you recommend or was that a dermatologist question, Dr. Cunningham, of a good sunscreen?
I'm sorry, I don't have. My wife yells at me for not using enough sunscreen, actually. So I don't have a good brand to recommend. I think the SPF, over 30, I think is the recommendation.
Okay.
But that's a good question for, again, a rheumatologist or a dermatologist or a primary care doctor.
So it looks like we're putting together our team of what you need when you're in lupus as a rheumatologist, a dermatologist, and perhaps a mental health professional. So we're getting there. We're building our team. Dalila, what advice would you have for somebody who has just been diagnosed with lupus?
You know, it's easier said than done, because when you're actually going through it and people's telling you, oh, it's going to be okay, and things like that, it's hard to believe that. So my advice would be to get as much education as you can. Ask a lot of questions when you are talking to the doctor. If you don't understand it, ask questions after questions after questions, because it's very important to educate yourself on these things after you've been diagnosed, so you can have a good understanding of it. There is hope, and I have to keep saying that, because when you hearing all this bad news and so many medications that I had to take and things like that, it can get overwhelming. It can, be stressful, but at the end of the road, you're going to see the progress towards it for sure, because I've been through it and I know. But like I said, that's for me. But people just ask a lot of questions. If you're on medication, do not skip any doses at all. Like, that's my main thing I would like to say, especially educating yourself on it.
Dr. Cunningham, is it a thing that when you have a kidney transplant that your lupus will go into remission? Is that true?
Well, it's pretty uncommon to have it flare up. It's possible, and so everybody's different, but the medicines you're on for the transplant suppress your immune system. So probably because of that, we don't see it affect the kidney itself so often. It's possible still to have like joint pain or rash, but usually not. Thank goodness.
Okay. I think, Dalila, to pick up on your point of some things that you'd advise people when they're newly diagnosed is because it can impact your physical and mental well-being.
Yes.
So I think it's important to allow yourself to feel all the feels, all the emotions, right? That come along with it, because there are a lot. You'll get overwhelmed.
It's a lot, because it's a different lifestyle. It's a totally different lifestyle. I always tell myself, things like, if I give up now and if I don't do what I have to do now, like, I won't be able to accomplish my goals. I won't be able to, live my life the way I want to. So, like I said, it's easier said than done when you're going through it. It's very hard, but go through the steps, listen to your doctor, take your medicine, do what's best for you for your mental health, because everyone has their own way of, calming down or whatever's best for you. Do whatever's best for you to control your mental health, but just keep going. Just keep going.
Yeah. Because all of those emotions that come with it can be exacerbated by all of the physical symptoms that we're dealing with on top of it, and the medications, and then just the chronic nature of lupus in itself, right? So let's see. I would.
Because lupus comes and go. I don't know when I will have a flare up. That's the thing. Like, I could, for a whole week, I could have so much energy. I could feel good. And then the next week I would feel, I'm like, what happened? I'm like, I ate right. I exercised. I wasn't stressed. You just never know when your immune system will attack you. You don't know. And that's the stressful part that I still deal with to this day. It's like, why am I feeling like this today? Next thing you know, my lupus flared up for some reason. Just say, hey, I'm here.
Like you said, we make all these plans, and it's hard too when your friendships and your relationships, right? Because you make all these plans to do things, and then your body laughs and was like, not today. And so it's hard to get friends to understand that I really was going, but I woke up today and my body said, no, we're not. So how do you handle that, right? Because you seem that your friends seem to think you're flaky, or you keep blowing them off, but we can't. And that's really, for me, a hard part about the lupus is that it just rears its head, and there's no rhyme or reason to it. One day you're fine, and the next day you're laid in the bed for 1, 2, maybe 4 days with a flare. Your flares also, it could be simple, or they could be a few days.
Yes.
Yeah.
Yep. It's very tough. I think
So
by me educating and talking to my friends a little bit more, I think they understand now. I used to get upset, like you should understand, but I have to come to realization, like they don't understand, and it's okay if they understand, but they do now. Once they found out, more about me talking about it and things like that, but it's hurtful, especially now that I have a daughter. She wants to play and do this, and I'm tired. I'm tired. So I just give her Play-Doh, mess up the house, whatever I can for me to just relax while she do her thing. But yeah, it's tough sometimes.
I used to have when the kids were young, because I think my kids were 6 and 7, Christian was. So that means Kennedy was like 2 or 3 when I was doing the Cytoxin and going through all of that. So I had a lupus flare box, literally a box for the kids, a lupus flare kid box. So when mommy pulled those out, those were the days that they knew mommy quite couldn't handle things, but also having a really good support team. Because when I was doing Cytoxin and I was nauseous, I had a group of people, either neighbors or friends, that would come and pick the kids up and take them to school for me in the morning. And then I had one girlfriend that was holding my hair back because I was nauseous so just having a really, really good, support team. So Dr. Cunningham, what would you say as we get ready we're going to ask and see if we have any questions, but what is your word of advice to people that are living with lupus or just finding out, or how to best interact with their care team?
I would just echo what you guys were just saying, which is don't be afraid to ask questions. Tell us, on the medical side, what's going on. Tell us what your concerns are. If you're worried you're having a side effect of medicine, just tell us. I want to know so that we can help you, get the care you need. If you have concerns, I don't want people to live with too much anxiety. There's going to be a certain amount of anxiety that is unavoidable, but just if you have concerns, just communicate and try to get answers.
Yeah, I'd say perseverance, resilience are important for managing the challenges of lupus. I think I found that to be true for sure, especially when dealing with lupus flares and just managing our stress. All right, Dalila, that's hard. That's easier said than done for sure for anybody, not even just people with, and just maintaining a positive outlook, because it's gonna be better. And it's just, I think the hard part too is accepting that this is our new normal. So normal looks for everybody, right? Yeah. So do we have any questions from the chat? And if not, I want to thank you, Dr. Cunningham, for sharing your knowledge. Really appreciate it. I even learned a lot for somebody that's been living with lupus for all these years. So thank you. And Dalila, thank you so much for sharing your story. It is always inspirational. And every time I see either you or Emmanuel or little one running around, it just reminds me of the days and how she got here and what a blessing it is and what a miracle she is, actually. So we want to thank you. And I'm going to turn it over to Rachel. We're going to remind you once again, we have the save the dates for Kidney Connection sessions, and our webinar, Lunch and Learn webinars, are part of that Kidney Connections. So our next in-person is where you're going to get a chance to communicate, collaborate, and with other people that are living with kidney disease. That will be held in person on Saturday, September 13th at the Marriott Courtyard, Chicago, at the UIC Medical District. And then our next webinar will be Thursday, November 13th, at 12 o'clock. And that will be another virtual Zoom, and it will be about diabetes and nutrition. So that is going to be another really good one. So we want to thank you for joining us. We hope that you learned something. If we didn't get to your question or you want to reach out, I'm going to drop, Dalila, is it okay if you want to drop your contact information in the chat? If anybody has any questions and they want to touch with you, I'm going to drop my email. And Dalila, if you would drop yours. So again, we mentioned sometimes it's nice to talk to people. And Dr. Cunningham, if you want to drop yours as well, if that's okay. So if anybody has any questions and wants to get in touch with any of us, feel free to reach out. But we thank you again for joining us for today's Lunch and Learn. And I hope you were able to get lunch, and I hope you were able to learn something about the connection with lupus and kidney disease. Thank you so much for joining us.
Thank
Thank you.
you. Thank you, everyone.
Good to meet you.
Thanks.
Thank you.